We lose about 30 children in Clark County a year to unsafe sleep environments. 50% of the families cannot afford enough diapers to keep their children clean, healthy, and dry. Nationwide, Black women are 3 times more likely to die in childbirth. In the state of Nevada, 4 times more likely. It's really dangerous.
That simple action like a diaper, how can it have such a big impact?
If folks don't have diapers to send their children to daycare, they can't get to work or school. Our childcare costs are the second highest in the nation. Our wages are not the second highest in the nation, so there's a math problem here. The starting salary for a nurse in the state of Nevada will put her squarely into the middle class.
So in this episode, I'm going to take a pause and start giving our guest a little context of what we're doing, because we just went out and started doing podcasts, doing Vegas Voices. Okay. So Kelly, I had this idea in the shower, right? I've always wanted to build, 1, my personal brand, and 2, do something for my great city, right? So the idea just convoluted, and one day in the shower, actually in the sauna, came Vegas Voices. And I said, well, if I'm going to do something, I'm going to commit to at least 100. Okay. And I did commit to doing 100 podcasts. And I said, do I have 100 people around that I can go interview in this beautiful city? Yes. Sure. And the next thing I thought is something has to have a frame. Okay. Right. So my frame is Vegas. I love the city, and I've been in here for 22 years. Okay. So I'm an immigrant, but now I consider Las Vegas home. And this adventure has taken us in so many different directions, because there's Vegas Voices out there. Yes. Right. Great stories. There's great stories, and they're to be found. And we've gone through so many layers of the city. We've been with artists, entrepreneurs, different business owners, and now we get to go into the nonprofit realm. Sure. And this is the first outreach that somebody did, please come and interview us. And I'm very, very proud of that first achievement. And as I was researching you, Kelly Maxwell, I found out that you're very interested, and your passion is to go and attend after the childcare crisis. Yes. I think we all have to have, this podcast has a mission. We're finding layers and people. And given that context, can you give us a little bit of your backstory? Sure. So I am a native Las Vegan. My family came here in the 50s, actually. My stepfather owned a limousine company, and was an entrepreneur and an incredibly hard worker. And I learned a lot from watching him build a business as a minority, as an uneducated man, watching him really fight through oppression, discrimination, operating business out here in the wild, wild west. So I learned a lot of those lessons about business development, but more importantly about grit, resilience, really that fight. So I take those lessons I've taken them into various iterations in my career, but now also in nonprofit leadership. Cool. So tell us a little bit more, we're celebrating International Women's Month. Sure. And we want to highlight the impactful work you're doing for Baby's Bounty. Sure. Could you start by sharing a bit about, what started you in this path? I know you were in business, and you're a sommelier, and you have so many layers to you, but how did everything turn into coming into a nonprofit? Sure. So this was never part of my plan, which I think oftentimes yields the most interesting lives. So I worked initially out of college, I worked in food and beverage. I opened my own catering company. I did that for quite some time. I worked in the corporate world, for some of the hotels here on the Strip in food and beverage, and then in business development and restaurant consulting. I had the opportunity to be the COO of both a restaurant group and kind of a technology company at the same time.
and never had any intention of moving into nonprofit leadership. I was on the board of directors for Baby's Bounty and was the president of the board at the time of COVID. And our founder and at the time executive director, Kim Amato, retired suddenly. So I stepped off the board into the role, which was supposed to be a 3-month stint to hire my replacement. And then I was going to move back into my career in the for-profit world. But as it turned out, this was the best decision I ever made to stay. And I get to do all the things that I love, like business development. I get to create programs, learn more about my community, learn more about the needs of the community that I love, and then pair it with kind of my type A personality, business development skills, and create impactful programs. So that's really the best of what I've learned along the way. And I get to do that every day and have the added benefit of helping, at this point, 45,000 Nevadans.
Well, as a guy, I was completely oblivious. I did copious research on your organization and on you. And I was completely oblivious that there would be a nonprofit that caters to the basics, is, sure, giving diapers to low-income families.
Sure.
And that's what Baby's Bounty is the base of. But can you expound more on what the organization does?
Sure. So we're a 16-year-old nonprofit, initially developed to improve health outcomes for families living in poverty. We did that with one essential program for quite some time, which is our Baby Bundle program. The Baby Bundle provides all of the items needed to care for a newborn for the first 6 months of life. Our founder realized that these individuals were leaving the hospital with no supplies, so no crib, no car seat, and putting these children at risk for a whole host of injury and illnesses by not having the adequate tools. And also, they lacked the education to properly care for their newborn. So she created this program wherein clients receive this baby shower in a bag, but there's also an education component to empower them to take the best possible care of their newborn.
So it's not only diapers. There's a lot more to it.
Correct. It started with that program, and that's all we did for 12 of the past 16 years. And then when COVID hit, we launched diaper banks. We realized that every major city has 2 or 3 diaper banks, and our entire state of Nevada did not have one consistent diaper bank resource.
What the heck is a diaper bank? See, my oblivious guy, I'm like completely out of context.
Sure. So diaper bank operates much like a food bank. Okay. So clients who are in need register online and they attend our diaper bank events. There's a diaper bank every Wednesday somewhere in the state of Nevada. We're now statewide, so we're Las Vegas, Henderson, North Las Vegas, and Reno Sparks. We also have 2 mobile diaper bank units to address diaper need in rural communities. But our clients, they register, they show up, and we will provide them with a week's supply of diapers and wipes for up to 3 children per household.
Wow. And you've said you've helped over 45,000 people, right?
Yes, correct.
How does that, being that you were in the, how does that make you feel like from, before being in a corporate environment and going gung-ho and building companies and all that stuff? These are different numbers.
Sure. I think different numbers is a great way to put it, because we say here all the time that making money is nice, but this is better, right? Making money is fun. And, a lot of times you're working in these hotels on the Strip and you're making money for multimillionaires, billionaires sometimes. And, it was important for me to be good at what I do and good at my job. And I was successful there. But at the end of the day, helping families in need feels better. And when we can do it on this scale, that satisfied both my need to have a positive impact on my community and also satisfy that business development part that I love so much. That it's a creative process. It's innovation. It's seeing something through all the way from conception through to project implementation. And that's really exciting for me.
I know. I'm a business owner too. And everything is, and I help other business owners through marketing.
Sure.
And I see that everything is numbers, right? And probably, I don't know if I guess this nonprofit is blessed to have you as a business person, because maybe nonprofits don't have that vision, right? Of you gotta hit numbers, you gotta spend less, and you gotta make more.
Sure.
And you gotta administer resources, which is what we do as business owners,
sure.
right?
That's exactly it. I think about this idea all the time that I think the most impactful nonprofit leaders came from the business sector and probably shouldn't stay in nonprofit leadership that long. I think there are plenty of social service minded leaders that are doing great work. I think that the learning curve for the business part of it is a little more challenging. My experience has been that this is just a business. This is a business just like every other business. It just so happens that we don't sell products for profit, although I have to create programs and go out into the community and sell their value and get investors in terms of donors. Or grant writing. And so really the ideas are the same. And when you look at the structure of a nonprofit, it's exactly like a business. My highest expenses are payroll, just like really any other business. There are, products. There's no free internet service or rent for nonprofits. We have all the same expenses as every other business.
That's crazy.
Yeah.
So tell me some adventures of going out and getting donors and grants, because that's the sales, right?
That's it.
There's probably other it's limited resources for a vast amount of nonprofits, right? How do you stand out?
That's right. There's a lot of us competing for the same dollars, and that field is narrowing even more now as different federal guidelines come into place and funding parameters change for all sorts of corporations. We've been very fortunate. We've also created programs that are really attractive to donors. So our greatest donors have been the Medicaid providers for our state. They all have a contract with our state that they are required to give money back to community-based organizations. And we've created programs like our diaper banks that directly impact health and well-being of families, particularly mothers and children. So we can go out, we create a program, we have the data, there's good national data, and we also collect our own data, and then you craft that into a story, and you go out to donors and you explain what you do and why, how it benefits the community, how it also reduces statewide costs, right? So it's also an investment in our community with a really good ROI. If a diaper bank is properly funded, statewide medical costs go down $4.7 million, right? So you could give me $1 million, right?
That's crazy. How do you correlate that?
Right. So there's less hospital visits for, children.
Because kids are cleaner.
Exactly.
Per se,
they're
right?
clean, healthy, and dry if they have enough diapers. So they're not showing up at hospitals, which we know, right? If you give them a 25-cent diaper, you may prevent a hospital visit that might cost $10,000.
It's very funny how you're giving me first, second, and third consequences of a good action, right? We think about first, second, and third consequences of bad stuff, but a simple action like a diaper, how can it have such a big impact?
Right. There's also the socioeconomic impact, which people never consider, which is if folks don't have diapers to send their children to daycare, they can't get to work or school. So on average, families who rely on daycare have called in sick 4 times in the last month because they didn't have the diapers to send their children to daycare. So you're a business owner. How long would you be able to keep an employee if they called in sick once a week? I have employees. I wouldn't be able to keep them despite wanting to, right? But we've got to, if we make these little investment in families, we can get them back on their path to self-sufficiency if they're able.
Wow. So I'd like to dive in deeper in the cause that you chose. And I found that there's 2 exact words, the childcare crisis. How would you define that?
Well, in our state in particular, our childcare costs are the second highest in the nation. Our wages are not the second highest in the nation, so there's a math problem here, right?
Okay.
Our residents are struggling not only to afford daycare, but there's not enough spots in daycare. So I've been working with Congressman Stephen Horsford's team to craft a childcare solutions summit that offers some tangible solutions to this problem. We have a whole host of ideas on the table, but we're bringing in private sector, public sector. We have organizations like the YMCA. They're already doing a great job in childcare, expanding their services to include more families to make it more affordable. But the childcare, the math doesn't work very well. It's not a great business model to fit into capitalism. It really needs to be subsidized for it to work. So we were relying on some federal funding dollars that I'm not certain will be available. So there may be some more innovation and some more creativity that needs to be applied to this challenge.
And it takes good entrepreneurs and good people like you to look at these things and see that there's a problem, there's a big need, and it has to be solved, right?
Yeah.
I'm just
big problems.
No, and I love it because it's just you're bringing light, and I'm glad that this venue is bringing light to your cause because I was completely oblivious to it, right?
Sure.
And I'm sure that there's thousands of people that are completely oblivious to it.
Sure. I had no idea that diapers were a critical component of poverty and of generational poverty until I started doing this work. And not even initially, because we had one program, but until I started this diaper bank and really dove deep into the data that shows us how critical they are to getting families, lifting them out of poverty. I had no idea how impactful this was.
Okay. Yeah. And when I mentioned childcare crisis, I thought you were going to mention, and that's probably a whole other problem. There's orphans or there's kids that are out, there might be so many different scenarios, but I guess the way you put it is a great way to put it, right? I'd like to delve into, you've gone to associate with higher ed.
Yes.
Because that's probably a lot of moms are going through their education and they need help with their diapers. Can you?
Sure. So that is a program I created a few years ago. In having conversations with our diaper bank clients, we realized that a portion of them were in school. And initially, they couldn't pick up during our diaper bank times because they were in school. And so we would make exceptions so that they could pick up at off hours. But I realized that there was an opportunity to dig in a little deeper there and to see if maybe we could help in a more impactful way. So I started having conversations with the chancellor of the Nevada System of Higher Education, and then some university presidents that I knew, to ask if they thought this could work. And, there was some interest here and there, and then some pushback. Well, I'm not really sure if we have that many students that could use it. As it turns out, 28% of college students in the state of Nevada, the highest in the nation, are parenting. So, not necessarily all of them have children in diapers, but a good portion of them do. So we started going to these universities. We met with all the presidents. We explained what we wanted to do. It was a really easy yes for them because there was no ask from the university. It was just, we would like to launch this pilot program wherein we provide your parenting college students with all of the diapers they need while they're enrolled in higher ed. And, we started the program. Our pilot program was 200 students across the NSHE institutions. And this year we're supporting 307 parenting college students. So It's really exciting. In fact, just yesterday we had a service project with the Board of Regents for the Nevada System of Higher Education, as well as several of the university presidents. They came here and participated in packing bags for the program, and hearing from 2 students who were recipients of the program and talking about how not only receiving the supplies meant something, as it certainly does. But one of the women who's a nursing student at Nevada State University said, being a parenting student, you really sometimes feel alone. And knowing that this team thought about us and really cared to solve a problem in our lives, that's really more motivating than anything else. So that's where we kind of all lost it. That's where, we feel it, right? We feel the help that we're that we're giving these students and the hope that they can do it and that we believe in them, right? One of the other projects they did was that the regents and the presidents wrote them encouragement cards. To imagine you're a parenting college student and you're working 2 jobs and you're going to school and you're trying to make time for parenting and sleep and study, right? And in your bag of diapers and wipes, you receive, a note from your college president that says, "You got it. I believe in you. You can do this."
That's amazing.
It's pretty cool, right?
That is amazing. Do you guys have initiatives that people come and volunteer and do these packing?
We do.
Okay.
And some of our parenting college students will then come and volunteer to give back, right? The universities send volunteers, but we also have a lot of volunteer opportunities for these, for our diaper bank, for Diapers for Diplomas, and for the bundle program.
Okay, that's good to know. I've been on 3 Square, like packing meals and stuff like that. So I can probably share this. I belong to a couple of entrepreneurs organizations like EO.
Yes.
It might be something that we can share with them and,
Wonderful.
And have some volunteering.
Wonderful.
So I hear you're pretty kick-ass in the sense of getting sales tax removed from
that was a lot of fun.
From diapers. Getting into the pockets of the government and taking money out of that takes a pretty kick-ass person.
That was a lot of fun.
Tell me that story, man, because it was Yes on 5 or something.
Yes, exactly.
Initiative.
So in the last legislative cycle, 2 years ago, we had the opportunity to work with Senator Edgar Flores and craft a bill, Senate Bill 428, to effectively remove the sales tax on diapers for 25 years. So a sales tax abatement.
Is that just in the States?
Just in the States.
Yeah.
19 other states and the District of Columbia exempt sales tax diapers from sales tax as well. Okay. But we wanted to join that. And really, diapers shouldn't be taxable in the first place. They're taxed as luxury items. And we know, of course, that these are preventative medical supplies. Mm-hmm. And as a state, we don't tax other preventative medical supplies. So we were just righting the wrong, really. But it did require 6 trips to Carson City, 6 times testifying and watching that through all of those votes and guiding the process and doing some kind of de facto lobbying on the back end. And I'm not a lobbyist. I don't work in politics or government at all, but I've sort of now had to take a crash course on how that works. And it was a fascinating process. It was arduous. There's a lot of unknown in bill passing. The governor vetoed a whole lot of bills in that last cycle. So, we were fortunate that he signed our bill. And then that next step was that it had to go on the ballot in November. So then we launched a campaign to let everyone know what Yes on 5 was and what the ramifications were for families. And it passed with almost 70% of the vote, which was pretty great.
That's a lot of freaking work.
It's a lot of work.
You have to push it first through the governmental entity, whatever.
Exactly.
And then you have to push it to the people.
Exactly. So you have to, and we were fortunate that, I find that national politics are far more polarized than I see on the state level. That's my experience, my perception. I really found that our state legislators were willing to listen. They were willing to look at the math, at the numbers, and we passed 6 votes with unanimous bipartisan support. Wow. That has to be some kind of record, right? But we were able to explain the need and why this is so important and how impactful it will be for families. And they all got it on both sides of the aisle.
Hence, that's why you need a good entrepreneur.
Right.
With that sales spirit, right? Yes. You got to sell your point.
That's it. It's all the same skill set.
It's the same skill set.
It is.
Absolutely. And probably somebody else would not have been able to get through.
It will actually save Nevada families $400 million over 25 years. So
yeah, and you can measure it as business owner, an opportunity. You can see opportunity cost, right?
Yes.
Which is what you're talking about
yes.
here, right? You can measure that and say it'll be this much.
Sure.
Because first, second, and third level of consequences.
Exactly.
Wow. So, among all these different things that have happened, I'm very curious if you could share a success story or testimonial, maybe from a parent, maybe from a student, maybe from wherever you want, that really illustrates why your work really matters. That cool story that'll get us clickbaity on that tearjerker or whatever you want. Give me one or two or three.
So one of my favorite stories is a client that we honored at our gala last year.
Okay.
She's a parenting college student.
Because to clarify, you call a client an end user of?
Yes.
They're your clients.
Yes,
amazing.
Absolutely.
Okay.
So this young woman is a parenting college student with 4 children, 3 of whom have special needs. Her partner left because he didn't want to raise children with special needs. So she was forced to move in with her family. And she needed the help. And so she was working the overnight shift at Mandalay Bay at the front desk 5 nights a week. She's raising 4 children, 3 of whom have special needs. And she was a full-time nursing student at UNLV. Wow. She came to our Diapers for Diplomas program. We diapered all 3 children for the year, which is a $3,600 benefit for her. And she told us that she was able to cut down her hours to work only two nights a week because she was really working to pay for diapers. So this young woman is now in her last year to get her nursing degree. We are definitely going to that graduation. To be able to help someone with so much grit and so much resilience going into a field that is so needed in Nevada. And, you know, the starting salary for a nurse in the state of Nevada will put her squarely into the middle class. So she's changing the trajectory of her life and that of her children as well, with 1 degree and 1 job. So that story, I'm so proud of, you know, I'm so proud of her for that kind of resilience. That's something else. And who else do you want to take care of you as a nurse, but someone with that skill set, right?
That's truly like an illustration of the spirit of Nevada.
Yeah. Yeah.
Right? I find that grit. There's a special grit that we have here.
We do.
That's nowhere else.
Yeah, I agree.
Thank you for sharing that. Mm-hmm. How such a simple thing can have such a big effect.
Right?
Yes.
Yeah.
So in honor of International Women's Month, what do you think is the biggest misconception about women in leadership, especially in the nonprofit sector?
I think one of the misconceptions is that there's only one way to do it, that there's some way that women should be leaders, right? And I think it's incumbent upon us to bring our skill set and our personality and stylistically how we like to lead into any organization, and not look at what men have traditionally done in those leadership roles and try to fit in there somewhere. I think that's where the imposter syndrome comes in, when you're actually an imposter, right? Show up with your unique set of skills, and that makes a far better leader.
And that's what you've done.
Yeah.
And for women considering a leadership path, either launching a nonprofit or stepping into an executive role, what advice would you offer?
So, I mean, I think those are 2 questions. In terms of launching a nonprofit, I would say, first and foremost, go find somebody who's doing something close to what you want to do.
There's already enough out there.
Yes. And you may find a niche within another organization, but if you want to work in food security and in some niche there, go work at 3 Square and figure out that model and see if perhaps you can create a program within a larger organization that makes sense. Entrepreneurship in nonprofit is not always necessary. I mean, there's so many great organizations doing so much work throughout the community. Go help them first, and then see if your niche really makes sense. And as you examine that, it may shift, right? You may decide to shift your focus a little more and find that there's need in other areas. In terms of advice for female leaders, or someone stepping into the role or who wants to be a leader, I would say don't focus on the leadership. Focus on the work. If being a leader is in the cards for you, it'll show up that way. But I think if you just focus on the work, the clients doing really good, impactful work in your community, the leadership will show up.
Right, because there's sometimes people want to help white cats that are like this little
right
somewhere.
Right.
So that is a very, very good answer. I love it. So looking back, what words of wisdom would you share with your younger self just starting out?
Oof. I would say, and this keeps coming up for me, so I know it's true. Trust the universe. Stop trying to control your own life. I really thought I had an idea of what I was going to do and what would make me happy. And when I just got my hands off and let the universe guide, I wound up in exactly the right place.
It's an answer that most successful people tell me nowadays, really? Right? God laughs and no, we made plans and God laughs, right?
Yes, exactly.
And we just have to let the, like you said, the universe. There's a greater force.
Yes.
You just have to listen, right?
And for someone who kind of self-identifies as Type A, that's a hard lesson for me. I like to, control and guide, and I really do think I know best, but my evidence shows that that's not actually true, that I have been put in places and in front of people and at times that I needed to, and for my greater good, and hopefully for my community too. That's
a perfect segue for the next question, which is, over the years you've seen many ups and downs, like all of us. Is there any particular moment that stands out especially rewarding or validating for you personally?
Last year, I was invited by Congressman Stephen Horsford to attend the State of the Union address as his guest.
Wow.
And I had always been a...
State of the Union nationwide?
Yes,
or?
Yeah.
Okay.
Yeah. So I traveled to Washington, D.C., and sat in the
I thought it was going to be in the state, right? In the state capitol. No.
Yeah, I was his guest there and in D.C. and wound up spending the day there and taking some meetings in the Capitol and then watching Joe Biden's speech. And and I always had been a little bit of a political junkie, and my parents were as well. So grew up watching, of course, that speech every year, and being recognized for the work that I do and invited because of that was pretty impactful for me. It was sort of the culmination of a lot of work and passion. It was pretty great.
Wow,
it was pretty cool.
Wow.
That was definitely a surprising West Wing fantasy moment,
Well deserved.
Yeah, thank you.
All right. So let's go into our rapid fire section.
Okay.
What's your favorite local spot in Vegas to unwind?
Okay. La Strega.
La Strega?
Yeah.
I've never heard of that one.
Fantastic Italian restaurant in Summerlin.
Yeah. Okay. Fantastic. I'll be sure to take notes.
Yes.
I can take my wife.
Yes.
All right. Give me one word that describes Baby's Bounty.
Thoughtful.
Okay. It is, definitely. Never thought that would be the case, but now that you give me all this backstory, I understand. All right. A must-have new item for new moms, I guess, excepting diapers.
A safe sleep environment. That's what saves lives.
What's a safe?
So a safe sleep environment is either a crib or, in our case, we distribute portable cribs.
Okay.
But it is unsafe for children to be sleeping in bed with their parents, on sofas. When families are struggling in poverty, they oftentimes sleep their children in unsafe environments, and we lose about 30 children in Clark County a year to unsafe sleep environments. It's really dangerous.
Wow.
Yeah, so that's a must-have. a portable crib or a permanent crib.
Amazing. Wow. Give me the most eye-opening statistic you've learned in this role.
Half of families experience diaper need. Half.
Wow.
50% of the families nationwide cannot afford enough diapers to keep their children clean, healthy, and dry.
Wow.
Yeah.
Wow. It makes you think, why shouldn't that be like really subsidized by the state?
And there really aren't any federal programs that pay for diapers.
Well,
there's plenty for food, but not for diapers.
That could be your initiative.
Sure. Let's go.
Go up to Mr. Kennedy and bring it up. That's that's in his department.
Sure.
Very good. All right. So what's the future vision for Baby's Bounty in three words?
Black maternal health. So that, I think that requires a little bit more of an explanation.
Yes,
so nationwide, Black women are 3 times more likely to die in childbirth or the 6 weeks after. In the state of Nevada, 4 times more likely. So the nationwide statistic is horrifying, but we're not even, in the state of Nevada, we're not even there. Right?
That's a lot of multiples.
It's right.
Yes.
And it's one thing to look at that number, and then it's another thing to think about imagining that your friend, your sister, your mother, your aunt, your cousin, your spouse is 3 times more likely if they are Black to die in the hospital, and it nationwide, and 4 times here. How can we settle with that number and be okay with that? So my focus will be to really look at the data and find a few key areas where we can move the needle. So I think it's recruiting.
What's one idea? One of those
recruiting more OBGYNs, and specifically Black OBGYNs. And preferably Black female OBGYNs. We need more nurses of color in the state of Nevada. We need more nurses in general, but we also need more nurses.
What about scholarship programs?
Sure. So we've been having conversations kind of initially with some of the universities about how really it needs to start in CCSD with bringing young Black women into STEM. Yeah. And that's where it really needs to start.
You got to create the path.
Right, exactly. So once they get to college, they may already have a set idea. So we got to start a little bit earlier. And then more education for these mothers about how to advocate for themselves in an environment that might be hostile or dismissive.
Wow, this has been quite the enlightening conversation, man. Jeez, I still have goosebumps out of everything you've told me. For listeners who want to donate, volunteer, or otherwise support Baby's Bounty, where can they find more information or get in touch?
Yeah, so babiesbounty.org, easiest place to find out about volunteer opportunities, items that we need. And there's a link to fill out the information for volunteering. We always need volunteers. We're doing all of this with 5 paid employees. So we need 200 volunteers a year to facilitate all of this programming. So we really rely on our community.
Okay.
Yeah.
Are there any upcoming diaper banks, fundraisers, or volunteer opportunities that you would like to highlight?
So every Wednesday there is a diaper bank somewhere. So clients in need should go on our website. They should also follow us on social media, Baby's Bounty LV, so they can learn about the locations and times and dates of every single diaper bank. But there is no reason to be in diaper need in the state of Nevada while Baby's Bounty exists and operates. They can go every Wednesday if they need it and receive a week's supply of diapers.
Okay, every Wednesday, you heard it. I'm going to bring this out also to some of my organizations so that we might come and help out.
Great.
Kelly, I'm honored. Thank you so much for joining us and sharing this incredible work. Do you have any parting words or final message for those listening to us that could make a difference?
Well, I'm so grateful to be able to talk about the work that we do and the clients who we care about so deeply. I really hope I can share their stories and their struggles and let people know that the most important thing I've learned is to drop the judgment and just get curious about the lives of the people that you serve. And you'll find that they're not so different from your own. And oftentimes, through a series of unfortunate events, they may have wound up in a situation that they never intended. And that organizations like this exist to help them through a difficult time. So, and I'm honored to do it. It's the best thing I've ever done.
And this is the reason why we have this show, to have Vegas voices in, like Kelly Maxwell. Thank you so much.
Thank you. Thank you for having me.